Have you ever sat at your kitchen table holding a slip of paper from the dental office with a number written on it, $300, maybe $4, for something they called a deep cleaning, and felt your stomach quietly drop? You did not say anything in the chair. You just took the paper and you have been not looking at it ever since. I want to talk to you about that number today because there is a great deal about it that you were never told. What if I said that a habit costing about $3, done between your visits, can keep a lot of you from ever needing that big bill as often, and in some cases at all? Now let me stop you before you even think it. So I can just skip the dentist then, Dr. Hale? No, absolutely not. And I will say that more than once today because it matters. There is a world of difference between skipping your care and simply not feeding the problem between visits. One is dangerous, the other is just smart. I am Dr. Warren Hale, your neighborhood dentist, and after 30 years chairside, I have watched good people on fixed incomes get frightened by that paper, and I have also watched a few of them get sold something they did not need. Dental work is not covered by Medicare, as you painfully know, so every one of these bills lands hard. So drop the shame at the door. This is not your fault. Nobody ever explained the fine print to you. Grab a pen because today I am going to tell you exactly what a deep cleaning really is. The $3 habit that keeps you from needing it. The questions that protect you from being overcharged. And the honest moment when you truly do need the procedure and must not refuse it. One quick, honest word first. I am here to teach, not to diagnose you. I am not your dentist, and nothing here replaces a real exam by someone looking in your mouth. If your gums bleed, hurt, or change, please see your own dentist. Clear. Good. Let us get into it. Let me start with what most folks get wrong, because the whole thing turns on it. There are two completely different procedures that both get called a cleaning, and they are not the same animal. The first is the regular cleaning, the one you have had your whole life. The proper name is a prophylaxis. It cleans the surfaces of the teeth above the gum line and just at it in a mouth that is basically healthy, and you have it once or twice a year. That one is routine, and you should keep having it. The second is the deep cleaning, and the proper name is scaling and root planing. That one is not routine. It is a real medical treatment for actual gum disease, where the cleaning goes down below the gum line onto the roots of the teeth to remove hardened tartar that has crept under the gum, often with the area numbed, usually split across 2 visits, one side of the mouth at a time. Here is the honest truth. When it is genuinely needed, scaling and root planing is a good and necessary procedure, and it can save your teeth. The trouble is only this. Sometimes it is recommended when a simple regular cleaning would have done, and most people have no way to tell the difference. By the end of this video, you will. Let me take a moment to tell you what the deep cleaning actually involves, because the fear of the unknown is half of what makes that paper so frightening. When it is truly needed, the hygienist or dentist numbs the area first so you do not feel it, and then they clean below the gum line, down along the roots of the teeth, removing the hardened tartar that has packed itself into the pockets. They usually do one section of the mouth at a time, often across 2 visits, so you are not numb everywhere at once and can still get home and eat. Afterward, your gums may be a little tender for a day or 2, and they will tell you to rinse with warm salt water. That is the whole of it. It is not surgery. It is a deep, careful cleaning of the part of the tooth that has slipped below the gum. When the disease is real, it is one of the best things you can do for your mouth, and people often tell me afterward that their gums feel firmer and healthier than they have in years. So I never want you to fear the procedure itself. I only want you to be certain you genuinely need it before you pay for it. So why does anyone end up needing the deep version in the first place? Let me tell you, because this is where your $3 comes in. That soft, sticky film of bacteria called plaque builds on your teeth every day. If it is not cleared, within a day or two, your own saliva hardens it into tartar, like cement. Now, above the gum line, that is one problem. But the place it does the real damage is between your teeth and just under the gum line, in the tight spots your toothbrush physically cannot reach. Plaque sits there, hardens there, and your gum gets inflamed and starts to pull away from the tooth, forming a little pocket. The deeper that pocket gets, the more tartar packs into it, and the more the bone underneath begins to melt away. That, right there, is the disease that the deep cleaning treats. And here is the thing that ought to make you sit up. The single most common reason those pockets ever form is plaque left sitting between the teeth, day after day, uncleaned. Which means the cheapest thing in the whole mouth, done daily, prevents the most expensive thing on that paper. For almost all of human history, by the way, people did not have this problem the way we do. Before sugar and soft white flour filled every meal, the bacteria simply were not fed the way ours are fed now, and coarse food helped keep the teeth clean as people chewed. The food changed faster than our mouths could. So this is not a personal failing. It just means we have to clean on purpose what their diet once handled for free. So here is the $3 habit, and I am going to be very specific. The thing that keeps those pockets from ever forming is cleaning between your teeth every single day, because that is the one place the brush cannot go, and the one place the trouble starts. A spool of floss costs about $3 and lasts months. If your hands are not what they used to be, and for so many of us they are not, then a pack of little interdental brushes on a handle or a water flosser does the same job and is far easier to hold. Pair that with a soft brush angled gently into the gum line, 2 minutes, twice a day, and one more nearly free thing, a warm saltwater rinse. Half a teaspoon of ordinary salt in a cup of warm water, swished for 30 seconds or so, once or twice a day for a week or two when your gums feel tender. That warm salt water will not perform miracles, I want to be honest about that, but it gently soothes inflamed gum tissue and helps calm the earliest stage down while your daily cleaning does the real work. Pennies a day against hundreds of dollars. That is the trade. I think of a man I will call Roy, who walked in clutching one of those papers. A deep cleaning quoted on a mouth he had been told for years was perfectly fine. He was ready to put it on a credit card he could not really afford. We slowed down and looked together. His pocket numbers were mostly 3s, with a couple of 4s in the back where he had never once cleaned between the teeth. And there was no real bone loss on the film. What Roy needed that day was not a $300 procedure. He needed to start cleaning 2 back teeth he had skipped his whole life, and to keep his regular cleaning. 6 months later, those 4s had settled back down to 3s. Now, I have to be careful telling you Roy's story, because the opposite happens just as often. I have had patients who were certain they were fine, who turned out to have deep pockets and real bone loss, who put off the procedure to save money, and who lost teeth they could have kept. So Roy's lesson is not that deep cleanings are a scam. They are not. The lesson is to know your own numbers so you can tell which person you actually are. Now, I promised you honesty, and here is the most important honest beat in this entire video, so please hear it clearly. If you are in the early stage, where your gums bleed and are puffy, but the bone underneath is still sound, that stage is called gingivitis. And the good news is it can genuinely calm down and reverse with the daily habit I just gave you. But if it has already moved deeper, if you have true pockets and the X-ray shows bone has been lost, that is called periodontitis. And I have to be straight with you. No amount of flossing and salt water at home will reverse that. At that point, you genuinely need the scaling and root planing. The home habit cannot replace it, and refusing the procedure to save money is how people lose teeth they could have kept. So this is the rule. The $3 habit prevents the disease and reverses the earliest stage. Once it is established, you need the professional treatment. Full stop. Do not skip it. Let me tell you who is most at risk of ever reaching that stage, so you know whether to keep an extra close watch. If you smoke, your risk of serious gum disease climbs steeply, and smoking also masks the very bleeding that would otherwise warn you, so the disease hides and advances. If your mouth runs dry, from age or from the many medications that cause it, plaque builds faster without saliva to wash it away. If you grind or clench your teeth, that adds stress to the foundation. And if gum disease runs in your family, take that seriously. There is one more honest connection worth a single sentence. Certain whole body conditions, like poorly controlled blood sugar, can make gum disease worse. And the gum disease can make them harder to control in turn. So if that is you, it is worth a word with your doctor as well as your dentist. I will not wander any further into medical territory. It is not my lane, but you deserve to know that link is real. And one more thing the office rarely explains in plain words. After a deep cleaning, they will usually move you to a closer schedule, cleanings every 3 or 4 months instead of every 6, and they call it periodontal maintenance. Let me be fair about it. For a mouth that has truly had gum disease, that closer schedule is usually legitimate and genuinely helpful, because the disease can flare back if it is not watched. But you are still allowed to understand why you are on it, to watch your own numbers improve over time, and to ask whether you might step back down to twice a year once things are stable. A good office will welcome that question rather than bristle at it. So how do you tell which situation you are actually in and protect yourself from paying for the big procedure when you only needed the small one? This is the part nobody hands you, so write it down. When the hygienist pokes around your gums and calls out little numbers, 1, 2, 3, 3, 2, those are pocket depths measured in millimeters. In a healthy mouth, those numbers run about 1 to 3. When you start hearing 4s, 5s, and higher, especially along with bleeding and bone loss on the X-ray, that is the real picture that justifies a deep cleaning. So you are allowed to ask plainly and politely, what are my pocket depth numbers, and may I see them? You are allowed to ask, do I have bone loss on the X-ray? And may I see it on the screen? And if you are quoted a several $100 deep cleaning for the first time in your life, with shallow numbers and no bleeding and nothing on the X-ray, you are completely within your rights to say, I would like a second opinion before I schedule this. Now hold on, because I want to be fair here. This is my second honesty beat. I am not telling you your dentist is a liar. The great majority are honest people who got into this to help. But the office that was bought up by a chain 4 states away sometimes runs on quotas, and the only protection any of us has is understanding the numbers well enough to ask the right question. A good dentist will be glad you asked. That tells you something too. And let me give you the 3 questions to write down and carry with you, so you never forget them in the moment. 1. What are my pocket depth numbers? 2. May I see the bone level on my X-ray? And 3. If a deep cleaning is recommended, why now, and what changes if I wait a little? Those 3 questions, asked calmly and without apology, are the best protection you have ever going to find. Let me add it up plainly. A spool of floss or a pack of interdental brushes, about $3. A box of salt you probably already own. 2 minutes twice a day and a daily pass between the teeth. That habit prevents the pockets, which prevents the periodontitis, which is the thing that costs you $300 or $400 a quadrant and, far worse, costs people their teeth. And if you are already past the early stage, then please get the treatment you need and do not let the price talk you out of your own teeth, but go in armed with your numbers so you know it is the right call. That is how you stay both healthy and hard to overcharge. And keep seeing your own dentist. I will say it one more time because I meant it at the start. The $3 habit is what you do between visits. It is not a replacement for the person who can see below your gum line and read the bone you cannot. If your gums have been bleeding for weeks, that is not a someday. That is a make the appointment. Next time, I am going to walk you through the exact questions to ask before you ever agree to a crown or an implant, because that is where the truly large bills live and where a few good questions can save you the most. It is the natural next step after today. So take care of those teeth and be kind to yourself about them. Remember, they are the only set you get, and you are never too old to start saving them. I am Dr. Warren Hale. I will see you next time.